Xeroderma pigmentosum is a rare disorder transmitted in an autosomal recessive manner. Xero means dry, derma means skin, pigmentosum means pigment. It is characterized by photosensitivity, pigmentary changes, premature skin aging, and malignant tumor development. These manifestations are due to cellular hypersensitivity to ultraviolet radiation resulting from a defect in DNA repair. Xeroderma pigmentosum is also known as XP or de Sanctis-Cacchione syndrome. Xeroderma pigmentosum was first described in 1874 by Hebra and Moritz Kaposi. In 1882, Kaposi coined the term Xeroderma pigmentosum for the condition, referring to its characteristic dry, pigmented skin. Causes of Xeroderma pigmentosum. The major features of Xeroderma pigmentosum result from a buildup of unrepaired DNA damage. When UV rays damage genes that control cell growth and division, cells can either die or grow too fast and in an uncontrolled way. The main source of UV is the sun. Because people with XP need to strictly avoid sunlight, but can go outside at night, they have been called children of the dark, children of the night, and vampire children. These terms can be considered derogatory. You may also find some documentary films about this. Who is prone to Xeroderma pigmentosum? The disease affects about 1 in 100,000 worldwide. By region, it affects about 1 in 370 in India, 1 in 20,000 in Japan, 1 in 250,000 people in the United States, and 1 in 430,000 in Europe. It occurs equally common in males and females. Couples who are each a carrier of the Xeroderma pigmentosum trait are at greater risk of producing a child with Xeroderma pigmentosum. Parents already with a child with Xeroderma pigmentosum have a 1 in 4 chance of having another child with Xeroderma pigmentosum. Stages and symptoms of Xeroderma pigmentosum. The disease usually progresses through 3 stages. The skin appears normal at birth. The first stage occurs around 6 months after birth. Areas exposed to the sun such as the face show reddening of the skin with scaling and freckling. Irregular dark spots may also begin to appear. These skin changes progress to the neck and lower legs, and in severe cases, to the trunk. Over the winter months, these changes may diminish. Continued sun exposure will lead to the second stage, which is characterized by poikiloderma, skin atrophy, telangiectasia, mottled hyperpigmentation and hypopigmentation. The third stage is the development of actinic keratoses and skin cancers. These may occur as early as age 4 to 5 years and a mean of 8 years. They are more prevalent in sun-exposed areas such as the face. They include basal cell carcinoma, squamous cell carcinoma, melanoma. Eye problems occur in nearly 80% of Xeroderma pigmentosum patients. Eyes become painfully sensitive to the sun, photophobia. Eyes easily irritated, bloodshot and clouded. Conjunctivitis may occur. Non-cancerous and cancerous growths on the eyes may occur. Neurological problems occur in about 20% of Xeroderma pigmentosum. How is Xeroderma pigmentosum diagnosed? Usually, Xeroderma pigmentosum is detected in early infancy, around 1 to 2 years. A child presenting with severe sunburn after their first exposure to the sun may be a clue to the diagnosis of Xeroderma pigmentosum. Xeroderma pigmentosum can usually be conclusively diagnosed by measuring the DNA repair factor from skin or blood samples. Treatment for Xeroderma pigmentosum. There is no cure for the disorder. All treatment is symptomatic or preventive. Symptoms can be avoided or controlled by completely avoiding exposure to sunlight, either by staying indoors or wearing protective clothing and using sunscreen when outdoors. Patients should undergo frequent skin examinations by someone who has been taught to recognize signs of skin cancer. Any suspicious spots or growths should be immediately reported to the doctor. Prognose of Xeroderma pigmentosum. The average life expectancy of an individual with any type of Xeroderma pigmentosum and no neurological symptoms is approximately 37 years, and 29 years if neurological symptoms are present. People with xeroderma pigmentosum have a greatly increased risk of developing skin cancer. Without sun protection, about half of children with this condition develop their first skin cancer by age 10. If a person is diagnosed early, does not have severe neurological symptoms, and takes precautionary measures to completely avoid any exposure to UV light and sunlight, they may be able to survive until middle age. Meanwhile, it's very important to build a healthcare support team and patients' mutual support group. Following documentary film clips are about some xeroderma pigmentosum patients' life stories. You can find full versions links in the description.
Xeroderma pigmentosum, or XP, is a very rare, very real genetic disease where children lack the ability to protect themselves against the sunlight. They develop hundreds of skin and eye tumors. They require surgeries, grafting, cornea transplants, chemical treatments. There's less than 1,000 cases of XP in the world, less than 150 in the United States. And most of the children, because of lack of medical services or lack of the ability to block out the light, tend to die before adulthood.
I can't even explain it, but it's a disease that kids have, like I do, that we can't go out in the sun sometimes, but it's really annoying because my brothers can go outside and I can't.
Pain is indescribable. It feels like a really, really bad chemical burn, but it goes through your skin, into your muscle, all the way down to the bone, and there's no relief.
My friends are cool with it. That's all that matters. Friends that I knew since I was a little kid knew my situation. So I just do what everyone does in the daytime, during the nighttime. It's rough. I gotta deal with it.
All day. That's all I got. Kim, come on, man! No!
What's up?
Lastly, we hope everyone could pay more attention and show them more respect. Thanks for your watching. Please take care and stay safe.